you want to make sure that you pick the right person. And by the way, on the power of attorney and the healthcare proxy, you always want to have a backup because you never know what's going to happen. And number one, I don't think you want to come back and pay me to do a new one if your agent passes away. But more importantly, you may not have time to do that. So, or you may not be in a position to do it. So you always want to have a backup on these documents. With the healthcare proxy, like I said, it covers all medical decisions, including life-ending decision making. However, you should have a living will. A living will is the document that says, if I suffer substantial and irreversible loss of mental capacity, and I'm only being kept alive by machines, I don't want the machines. Now, you may have somebody who says, no, hook me up to car batteries, do whatever you gotta do, keep me going. It's your choice. But what happens is sometimes, and I'm Catholic, so I'm not picking on Catholics, but sometimes the Catholic hospitals will say, all right, we see you got a healthcare proxy, but we don't know if you really know what their wishes are regarding artificial nutrition and hydration. So the living will is the document that states that. It says, I don't want to be on the machines if I'm in the persistent vegetative state. And it's not a coma. People who come out of comas all the time. It's when you're in that persistent vegetative state.